So good morning, everyone. I'm Kevin Sherin. I'm a physician. I'm the health officer of the Florida Department of Health in Orange County. And I'm one of the two facilitators for this work group. We're going to be coming up with 2 or 3 objectives that can be worked on over the next year before the summit comes a year from now. So actually, you're joining a working group right now, and you'll be connected electronically through a system that's called Spark. Is that right? But before we do that, I want you guys to look at the posters over here, which were developed from Jones High School here in Orlando. These are posters that high school students have developed to increase amoeba awareness. So we're going to actually come up with some ideas to help promote prevention and awareness today, and end up with 2 or 3 objectives at the end, and we'll present those out after lunch. But I wanted you guys to go over there and take a look at those and just circulate around at the beginning here so you get to see them. So don't be shy, just stand up and walk around. Make the circle. And I'll just keep talking, all right? We don't have to waste our time. So at the end of the conversation today, we're going to ask one person to be the coordinator for this group. It won't be me. It'll be one of you, to be a volunteer to help coordinate our efforts over the next year, and to get into the Spark room and to work with the IT and to help keep the group connected to create 2 or 3 objectives, right? So look at the great creativity that some high school students have come up with. And by the way, this is an inner city high school. So these are students that are really passionate about this disease. They've become interested. They're pre-med. They want to go into pre-med. These are STEM students, science, technology, engineering, and math-oriented students that want to go forward with pre-med as their concentration in college. Okay?
You can also mention the paper.
Yes, I want you guys to vote. Which one do you like the best?
Here's their number.
And you've got worksheets to keep track of this. You got worksheets to keep track of it. You have worksheets to write down your thoughts about objectives today, right? So pick up your clipboards. This is a working session. Don't sit there. Dean Bodiger, get up, walk, man. This is a fitness exercise. I want you all to walk around. And I'll just babble along. Yeah, get your clipboards. We're gonna get our steps in. If you have a Fitbit, we want you to be active here today. So we want you to think in terms of the broader community as far as prevention. We want you to think in terms of healthcare. We want you to think in terms of public health. We're going to have a conversation that's pretty wide-ranging, but at the end of the session, we have to come up with 2 or 3 objectives that we're going to really work on together, okay? And you know, we have all day to do this, by the way.
I have a suggestion.
Yes.
While we're looking, take pictures, send it to your grandchildren, your children, send it to your friends, because that's what I'm doing now. My son.
I like it.
Just
Post them on Facebook, all right? I mean, there's no copyrights here.
So what's the potential for the winner? What is going to be done?
Andrew, what do you want to do? Andrew is, by the way, Andrew's with mentoring in medicine out of New York City and working here in Orlando with Jones High School. So what do you want to offer as a...
Sure. So first of all, I'm so excited to be here in
Andrew Morrison.
Orlando, Florida. This is going to be my new home come January and February as well. But,
All right. A smart guy.
Right. Yeah. Exactly. But we're a national nonprofit, and we've helped over 50,000 students from New York all the way to LA pursue careers in health and science. And here's an example of us training students to become what we call community health ambassadors. We're learning about a disease, and they think about how they can really begin to inform the community. So these are posters that students actually created within 2 days' notice. I was really impressed with the quality of their work. We also have a song. They created their own rap song as well.
Really?
Which we're going to be debuting for the very first time later on in the afternoon. But to answer your question directly, I told that the top 3 winners will receive $100 each from our nonprofit.
Oh, wow.
Yeah.
Awesome. So look, there's actual money involved in this. Huh? These students are going to be amply rewarded. Okay, so we're going to be talking about primary amoebic meningoencephalitis gaining the advantage, if we can get the slides to move. So as we learned about this morning, there's a 97.9% case fatality rate. That's changed a little bit with the survival of Sebastian, all right? We moved the needle closer to 97% than 97.9, right? So we have some wonderful news here from Florida Hospital here in Orlando. So Dr. Cabral, by the way, from Virginia Commonwealth University, has been working on this disease for a number of years, and she's one of the people who's with us at the conference today. Is she in the audience right now? I don't see her. But talk about prevention. She's been at this for a long, long time. So this is the problem. We've got this circle that just keeps spinning, right? People say it's rare. Sandra Gompf, Dr. Sandra Gompf is nodding her head. A very low infection rate. We don't want to say rare. We just say it's a very low infection rate, right? But an extremely high case fatality rate. We want to spin that around. We want to have a low case fatality rate. We want to diagnose this early. We want to have more recognition. We want to have more awareness. We want to have more prevention. So right now, unfortunately, we have low suspicion, low awareness. We have PAM looking very much like meningitis. Kind of a bad combination. Gee, there's a fair bit of meningitis in this country. You know, how many emergency rooms are going to have children or adults coming in with symptoms that are like meningitis? Severe headache, nuchal rigidity or stiffness of the neck, vomiting, fever. Not that uncommon, unfortunately, to get meningitis. So you can easily miss this diagnosis, as we learned about as an ER physician. But extremely fulminant infection, it just goes like gangbusters. It's like a wildfire. When the amoeba start to grow in the brain tissue, unless they're placed in check, unless you do all these Herculean things with the anti-amoebic therapies and, you know, cooling the core body temperature and having the ventilation, all the right things being done in a timely fashion, lowering the intracranial pressure with the ventilation and blowing off the carbon dioxide. You got to do everything right. You got to do it on time. Otherwise, it's a fulminant infection resulting in that extremely high case fatality rate. Yes, exactly. And in fact, there's a survival. We found a case in India of a 72-year-old man with multiple chronic diseases who, believe it or not, survived Naegleria. So that tells me one thing. You can cure this disease if you treat it in time. If a 72-year-old man in India with multiple chronic diseases can survive, we should be able to save children here in the United States with the modern facilities that we have and the appropriate anti-amoebic agents being given in time and the appropriate diagnosis. Because the lab tech in India did the same thing that happened here at Florida Hospital. They looked at the slide, and I know we're not supposed to be talking about diagnosis here in this session. We're talking about community awareness and treatment, but I'm giving you a little bit of the background. I think that we can totally spin this wheel around and have 98% survivability. So, a little refresher of what we learned this morning. The first two cases in Minnesota back in 2010. We've had an unusually long hot spell that particular year. We had cases reported in Kansas, a first case in Virginia since 1969, a first case in Indiana that happened in that 2010 to 2012 time period. And now this summer, we just had a case in Maryland of a New York child. So this is becoming a North American disease. You know, I've even been in touch with a colleague of mine in who works with Health Canada, and I said, look, if it's in Minnesota, you've got to worry about this in Ontario, right? This is going to be a North American disease. And we need to be cognizant of it anywhere in the United States. I don't know where the video from this is going to end up, but there really needs to be national notifiability. So here's a hint of one of the things we could talk about today for an objective. How can we help that process of national notifiability? Dr. Gumpf is nodding her head. So, physician awareness, these are bullets that can help us shape objectives today. We can work on physician awareness, we can work on public awareness, we can talk about other public health efforts, right? So national notifiability would be a public health effort. Here we are at the summit. This is our chance to make a difference in the next year, to have several objectives, to have several work groups come out of this session today, and to get into the Spark chat room and keep the project going over the next year. So this is an example of what the Florida Department of Health in Orange County has done for years. You know, since we had our outbreak, so to speak, in 2007, where 3 children died here in this county. They weren't all from this county. 2 were from the county, 1 was from another county, but they died in this county. And we've done the awareness with our schools. You know, the schools can push out messaging. We've had reverse call systems from the schools where the school district, you know, calls all 202,000 children, the parents of the children, and leaves messages at the end of the school year, caution about deadly amoeba season. You know, it's summer, it's amoeba season. But hey, it's summer all over the United States. So we need to get this concept of an amoeba season out there. Hey, that's an idea for an objective, to keep furthering that, right? I'm giving you hints of what we could talk about today, but it's going to be your idea. So this is our OCPS, and that's our Florida Department of Health. And messaging that we've done. This is what I did in the last year to try and increase physician awareness. I published a letter to the editor of the American Family Physician. It went to 186,000 physicians. It was a result of this summit last year. I said, oh my goodness, what can I do? You know, I'm a family physician. I'm also the health officer. But I can write a letter. You know, they said they wouldn't publish it. I said, oh, well, we'll see about that. You know, I have published things before, so I kept working on this until we got it, and it is published. So you can look that up in April 15 issue of the American Family Physician. It went to 186,000 physicians. So make up your mind of something you want to accomplish, and then just do it, right? But a group of people working together. What was it that Margaret Mead said? A group of committed citizens working together can change the world. So we know that physician awareness has increased. We've had North Carolina report, we've had South Carolina report, we've had Texas report, we've had Maryland report this year, or New York report, or Ohio report, because several of these children died in other states, although their exposure took place in the states I mentioned. They told me at the AMA that they wouldn't pass such a resolution. I don't take no for an answer, okay? So I wasn't determined about this physician awareness piece. So they said, oh, it's a rare disease. You can't do this. We're not even going to talk about it. They shot this down in November of last year after the summit. We brought it back in June, it passed. But you had the coalition now. You had the emergency physicians on board. You had the pediatricians on board. You know, had the surgeons on board, the infectious disease docs on board. You knew how to get things done. And so the American Association of Public Health Physicians, of which I'm a past president, my group raised this up, got it heard in the House of Delegates, got it passed. It's now AMA policy. And I'm asking Roger Brown in the AMA now, what are you going to do about it? What are you going to do to educate all the physicians in the United States on this? Because it is AMA policy. They said it couldn't be done. I don't take no for an answer. And here it is, policy number H-440.824, done. So the issue is we're going to stop that wheel from spinning the way it is. We're going to increase awareness, and we're going to increase prevention, and we're going to turn around the 97% case fatality rate to be in 97% survivability. I heard speakers today say 50%. I'm not satisfied with that. I want 97% survivability. Are you guys with me? Yes. We can do it with 100% prevention. Sandra hit the nail on the head. 100% of this is preventable. You know, treatment is the last option, truthfully. We want to prevent 100% of PAM. Let's just be clear. Sounding like President Obama. Let me be clear. 100% of PAM is preventable. That is what our session today is focusing on. Increasing awareness and prevention. How do we prevent 100% of PAM? I'm going to give you an idea on this. Neti pots. 2 cases in Louisiana in 2012. And the New York Times had an article September the 3rd, 2012 about neti pots and FDA issuing warnings. Well, if you walk into a store and buy a neti pot, does the neti pot have a warning on this? What can we do about that? Hint. Is that an objective?
Yes.
Okay. You're with me. You're listening. Done. Now it's time to go to work. So we're going to have a champion at the end. Does anyone want to volunteer to be the champion now of who's going to be the work group leader? And then maybe break out into 2 mini groups that work on 2 objectives? What do you think? Does anyone feel really motivated to be the champion of the entire group? All it means is you have to convene these meetings in the Spark Room. It's an electronic meeting.
I'll be the champion.
All right, we have a champion. You are the champion of the world. Okay, so we got to get your contact information so we can keep this group going and keep it lively. What's your name?
Jose Rodriguez.
Jose Rodriguez is the champion of our work group. Thank you, Jose. Where are you from?
Puerto Rico.
You're from Puerto Rico, but you're here in
Sanford, Florida.
You're from Sanford. Okay, so you're in our neighborhood here, and we got to connect you and contact information with everybody else who's in the room today. So how do we do that? Where's Jack? I want to allow time for my co-facilitator here to say some words. I've been hogging the show here. I'm sorry, Dr. Cole. We got Jose has stepped up. You don't want to talk? All right, so we got a champion for the group, and we want to come up with 2 objectives today out of this group, and we want to give them time to come up with their ideas. That's really the purpose of this. So it's community awareness and prevention. So it could be national notifiability. It could be, warnings on neti pots. There's any number of directions it could go, but we want them to come up with the ideas too. So.
Can I just pipe in while you're thinking?
I don't want to do the thinking. I want you guys.
No,
to do the
I'm from the lab, and I know that one of the questions. I mean, it's great. I shouldn't say this, but I will. September 15, we're going on board with a pop-up in emergency to say freshwater exposure.
Right.
So one of the questions in the lab was, should people only be aware during the hot season here in Florida? Well, I said not really, because somebody might be visiting a really hot country in December and coming over. So I think the awareness should be all year round, not just during the hot season. Because we're only thinking Foco, Florida. It's got to be, I mean.
All right. So we can have people coming here from Brazil,
Correct.
who their hot season is in, South America. Their hemisphere is different, and they can have summer in the winter, right? So because this is Orlando, we got international travelers coming here from all over the world, and our hospitals here, or anywhere in the United States for that matter, can have people coming from that other hemisphere where it's summer in Australia or whatever, right? So that's an excellent point. that we do have this deadly amoeba season, but if people have been exposed in a country where it's summer in their hemisphere, you gotta think about that as well. And so, basically, it's still taking into account the deadly amoeba season, if you will, and having that concept out there, right? But you have to extrapolate it now to the other hemisphere. Does that make sense?
So awareness should be 12 months of the year.
Now, there's another aspect to it, which unfortunately we see in Florida here, and this is detailed information that I just learned today. Dr. Cabral, that I mentioned from Virginia Commonwealth University, been studying this organism for years. Apparently she came here some years ago when we had our bad outbreak, and she sampled some lakes in February, when it was cold. The water was actually cold. And lo and behold, 90% of the lakes had the amoeba, okay? So it's, I mean, Florida, the lakes don't freeze over. It's gotta be really cold to do that here, you know, and I think the coldest temperature in this state ever was 2 below in Lake Butler, Florida. So it's rare that you're gonna have water freezing over in lakes in the state of Florida. So this amoeba apparently can survive in colder water, okay? I always thought it was 72 degrees and above, but hey, it's colder than that in the month of February, even here in Florida. You know, it's gonna be in the 50s in the water, right, Jack? So I'm a little confused about the deadly amoeba season, the only answer for awareness and prevention. We have had cases recorded in this state in different months that are outside the summer season, but it is most predominantly in the summer season. So what do you think about that?
It's probably a combination. It's more people in the water, so that raises it's a numbers game to a certain degree. So we have more people involved, and definitely the amoeba numbers will be higher if the water's warmer. Certainly we can't rely on just warm water. So the warmer the water, the more active they become, and the more common they are. But it's certainly, I think one of the awareness messages should be any fresh water, you know, and maybe my personal opinion is maybe not to be quite so dependent on the term warm, especially from our findings in Minnesota.
Right.
The water temperature there.
Right.
Because it's also underchlorinated and unchlorinated water, correct? So
Yes.
we leave our hoses out in January, that water gets hot, someone could be susceptible at that point.
That's right, and you know, as far as the hoses go, that reminds me of a case in Arizona, right?
Yeah.
I knew the guy who was the health officer in Phoenix, Arizona, and that's exactly what happened. So it was the underground water, which is very warm in Arizona, but it was also the hose where the people got it, the household, and there was Naegleria in the Maricopa County, Arizona, back around 2003. And the pathologist there, the medical examiner, had difficulty making the diagnosis at post-mortem. But that's what they traced it back to, was the hose, if I remember correctly. So you're absolutely right. So in these very hot climates, where it can get warm in the winter, I mean, it can snow in Tucson in January, it's possible. But, you know, they can also have heat, and the water in the hose can heat up, and the amoebas can survive underground. The water's very hot in Arizona, just like Australia. So it's variable in different parts of the United States as to how this thing is going to shake out. And then there can be geothermal parts of the United States. I'm thinking about, I don't know, Oregon or Alaska, you know, where they could have warm water in their water systems. Just thinking out loud, you know. So this thing becomes very complex when you start thinking about water systems. So we not only have neti pots, we have water systems to think about in terms of health protection and messaging. And I don't want to get too far into the weeds, but you're right, chlorination. Is the chlorination in the water systems adequate? The chlorination in the splash parks, the kiddie splash parks, Oklahoma. There were cases in Oklahoma where the splash parks were implicated, am I right?
I'm not sure about that one.
I don't know either, I'm losing track of it. Splash pads.
Those water exposures were never confirmed, so that's why we're not.
So chlorination of those water systems, the water parks, you know, how do they chlorinate their water systems? Should they be testing their water systems for amoeba? I'm just throwing that back to you. What do you think? I mean, the North Carolina one, you know?
No, go ahead. I don't.
Go ahead.
Well, I was going to say, CDC has a model aquatic code, which is science-based, on disinfecting and sanitizing pool systems, swimming pool systems. And I think that should be adopted. Because right now, it's state and local,
It varies by the locality, yep.
What would it take to have that water code adopted nationwide?
Well, it needs to happen, it's happening state by state. I don't know that there's a mechanism, since there is no federal regulation of pools, so that it happens at the state level. And Jake, you might know more about the model of, you guys do, yeah. So, I heard the last stats were a handful of states, a couple countries actually are looking into it as well. But it was our attempt at CDC, because there was such a patchwork of different regulations across the country, to put together its model code. I mean, there's a section that's purely model code, so it's written for like a legislature to take. And then, yeah, there's a whole compendium that goes with it that explains all the science behind the recommendations. And there's now a consortium or conference put together where it'll be continually reviewed every year to update any of that science. So that's, yeah, certainly a way to keep pools at a level where certainly both Naegleria and a lot of other diseases that are associated with water.
So one thought, if you want to have a uniform code that gets promulgated in different states, there's a conference of state legislatures, right? And oftentimes they will emulate one another's laws if there's a model state. So there's a national conference of state legislatures based in Washington, D.C. And if that organization could be brought on board to the importance of a public health issue, their staff could be educated to it. That's a thought on how you could get a model code to be looked at by different state legislatures. Just a thought. Now, there's also the political partisan approach. There are two different groups of state legislature organizations. So there's a conservative-based group. It goes by a different name. So in the instance of the state of Florida, they may not ascribe to everything the National Conference of State Legislatures says, because they're more conservative on the regulatory side. But how do you get it in front of the two bodies of state legislature groups at the national level to bring about that sort of education and change? That's my thought on that. And I don't know how that works between the CDC and those various organizations, or what they're allowed to do, because their money comes from the Congress, but a group like this is free to do what it wants. You see what I mean? So if you say, gee, we think there should be a model code, what would be the next steps to doing it? That would seem like a very reasonable thing, right?
Doctor, that's pretty powerful. You mentioned something about the schools and how the parents are called, etc. But sometimes when the children and the parents actually see perhaps a short video that you can put out, and maybe we have to go school per school to actually show them, you know, give us 10 minutes, 15 minutes of your time in the whole auditorium, and then they can actually see the
impact and the truth about it.
Yep.
I think maybe they should have, like maybe a little group within the schools, children, parents, teachers.
Yeah.
And that way they can all, do it year round. Have some, some kind of involvement to where the kids are actually participating in this, not just the parents.
Right.
One thing that's available through CDC that I worked on was CDC brings a group of science teachers to CDC usually every summer, and they work on lesson plans that are science-based, and as well as get public health messages out there. And so I actually collaborated with a group of teachers that came up with a science lesson plan around Naegleria fowleri. And so that way you incorporate some science with it, as well as getting the message out there. So that should be available online for free, and I could look into the exact website for that.
And that's a better way. The school's very difficult to get into. Their curriculum is so tight, they just don't let anybody come in. We tried to do asthma education and things like that. It's really, really difficult to get in.
They said, what about like the PTA though? So
Right, that's
parents
better,
that are
that
coming
one.
together, right? Because you can tell the kids, but will the message get home? If you can get into a PTA, they always have all kinds of small events, so maybe you can get in that way.
In churches.
And churches, yeah.
Schools have like teen advisory councils. We actually run ours here at the Florida Hospital for Children, and sometimes write down just to take notes. We can maybe put some together and try to reach out to community that way.
Right.
Teen advisory councils and family advisory councils, we have them here, so.
Right. So, you know, Florida Hospital has a reach of 10 different states, in a sense, because it's part of a larger health system. So, you know, some of the systems that we're talking about can reach further than our discussion today. But if we went to the PTA, you can start locally, and you can grow it from there. You can take community awareness as an objective, right? And you're going into schools, or you're trying to create awareness, you know, of different groups. You could take physician awareness and just take emergency physicians. You know, working with the Florida College of Emergency Physicians, Dr. Valenti is particularly excited about FCEP, Florida College of Emergency Physicians, taking the next step. Okay, so we could focus on our own state of Florida for physicians. This group can go in any number of different directions. Yeah.
So here's, this is kind of out there, but think about cancer. Everybody associates cancer with the pink ribbon, breast cancer.
Mhm.
What if there was something that we could come up with nationally that associates back to this?
I like it.
I mean, it would be for
I like the idea, because what you're talking about is creating a buzz, creating awareness. And you're
Right.
saying have some ribbon or something that becomes noticeable in the campaign.
that no matter who we are, where we are, like I said, like the pink ribbon, regardless what organization, they know that relates back to breast cancer.
Mm-hmm.
So I have a question. So the alert that you were mentioning earlier that you'd asked about if it should be year-round or just the summer season, is that going to just be in this health system, or is it going to be expanded to all of the health systems? You know, as a public health professional, I really feel that this is where we need to go with, is getting it out in the facilities where you have that physician awareness, that laboratorian awareness, where, you know, I mean, here in Florida, we've been preaching about Naegleria fowleri for a long time, and unfortunately, it still doesn't get to everyone, or the message isn't communicated clearly enough where, oh, we realized it wasn't safe in Florida, we didn't realize it wasn't safe elsewhere. I mean, we've changed some of our messaging to make sure that we incorporate that, but I think we need to start looking on a larger scale, and to me, the healthcare systems is where we need to go. I mean, I was the person who went to Anchorage, Alaska.
Yep.
And the position statement failed, and it was devastating. And, you know, but we've had additional calls with some of the council members from the state and territorial epidemiologists, and they said if we could show that policy change has helped to enable and identify and successfully save individuals, that would be a way that we could further and potentially get it passed. I mean, Dr. Sherin mentioned that there was one opposition. There were actually a couple of more states that were opposed. But I think if we can show that we're working in the private setting and having an impact and being able to identify these cases sooner, that it would be easier to get buy-in from those other states.
I want to piggyback onto that. I know that the system is going, and once the lab gets that, you know, that's a hint, and it's going to be all year round. if we do say Amoeba, yes, it's gonna go straight to the state lab. I'm gonna piggyback on that though. Florida Hospital, we're very strongly passionate about this. Is it time for us to get together for summits with Nemours and RMC, and it's gotta be like a community thing? That's my, like, and I know there are some from Orlando Health here, like Dr. Leon, et cetera. But we really should be working cohesively with our partners across the railroad track.
And yes, and as you know, Florida Hospital extends across the state. You have 24 operating units. I don't have to describe your system to you, but Adventist Health System goes into 10 states. So you can touch the whole state of Florida with Florida Hospital. You go into the Tampa Bay area, you're in the Tampa Bay area, you know, how do all these things work together? So from a hospital system perspective, I think y'all can work together and generate some real change, getting down to the laboratory level and the physician level, just by having a work group that says, okay, we're going to work on hospital systems. Hint, hint, that's a work group. That's an objective, right?
Is this symposium going to be available to the public to watch, like on the internet?
I can't answer that. How does this symposium work?
It will be. This will be on archived online, so the public can see this.
Yep. So Florida Hospital, Adventist Health System, I'm not a commercial for the company, but I would say it's the largest non-Catholic health system in the United States. Private. True statement. Yep.
So I have a question. You know, of course, when it comes to the medical and when we're talking about our school boards and the way we're educating, but are we educating these camps that we're bringing our kids to? Are we actually educating the parents that are bringing these kids to these camps? Are we educating the children that go to these camps before they go into the water?
It's a great question, and I can't answer that. So that particular question is on the level of community awareness and looking at the education of kids going to camps, right?
Yeah, I can add to that I feel like that was a theme this summer, with at least 2 cases that involved a camp. I am aware through a neighbor of mine who is a director of a camp in Georgia. There is a National Camp Association, and he showed me the past 2 years there have been email blasts that go out to the camp association about Naegleria. I think it's typically been after a case has occurred. So potentially having that be more something that happens as a preventive action just at the beginning of the summer, rather than in response to something.
Maybe like having all the kids have those clips. They all been handed to them prior.
Yeah.
You know, something is preventative.
I would think, my concern, I've recently become aware because of the one camp involved about these camps that have ponds or lakes that are dedicated just to, they have the lines that run across them to, I think they're common here maybe, I'm not as familiar, but that you, to wakeboard and water ski without a boat. That to me is a high-risk activity. And so if we wanted to focus the effort maybe a little more, maybe it's at those places where we say there should be a little more, you know, they probably have to fill something out, right? I mean, it's a dangerous activity regardless, so point out the other.
Most of these bodies of water that people go out and enjoy themselves, they have a ton of signs everywhere. Is it possible to join with those people that have the signs up there, that says, don't do this, don't do that, no diving, blah, blah, whatever, to put some kind of signage in all these bodies of water, to let people know, hey, this is here, it's present, this is what you should do if, call this number, whatever it is.
Yeah, I mean, I know you guys can probably talk about signage and difficulties with that, how effective we think that is.
Yeah, I like those posters because they deal specifically with Naegleria, not taking water up the nose, which is a portal of entry. Historically, what we've done with signs in the scenario you described is it does get molded in with other messaging with water safety, particularly at Orange County does have one of those parks you just described. We had 2 cases there, I think. And I don't know if they're still doing this, but I know when it happened, they were local health department was providing those clips and messaging. But understand the businesses, you know, they have to welcome us.
Yeah.
It happens.
That's the slippery slope.
That's the slippery slope. And then your wakeboarding, or my son does that. Are you really gonna learn those clips? That's a pretty macho sport. Or women do it too, I know, but still, it's high testosterone sport. You may or may not wear it and then not also be effective.
Right. 'Cause then is there
I think the message, and again, my favorite over these are ones that say, keep the water on your nose. And, you know, that applies to the water systems, and that applies to NETCOX. So that's just.
And I've worked in Kansas as well, and, I mean, we've had other issues, and I was there when we had the pancakes there. You know, and the talk was, do you put up signs? And where do you put up the signs? And how many signs do you need to put up? And who continues to go out and monitor to make sure that the signs are there and available? And then the signs blend in. I mean, I also worked with harmful algal blooms, and we posted lakes that had these blooms that could make you sick, killed your animals. And there was a sign, and we had my favorite picture was that we had people swimming behind it. And so you can put up as many signs and try and educate, but to me, that's not necessarily, you know, going to help. I mean, it's there, and then, but then again, when those signs come down or someone steals a sign, you know, is the owner of the lake responsible?
Yeah, I think the same, because this came up when we talked, you know, there's like inherent dangers to a lot of these activities we're talking about. It came up with the whitewater case that happened at the beginning of the summer. I know when you whitewater raft, you have to sign off on a lot of, you know, saying that you're taking all these risks. And we talked about, do we now include Niglaria, at least at that specific setting? And I just, you know, yeah, who reads those forms? They're really long.
That particular site, they do also have like a video before. My brother worked there this summer,
Oh, okay.
so they have a video that shows kind of safety tips. Maybe it's something they can incorporate in the video, because you have to sit and listen to that video before you can participate in the craft.
Yeah,
So
it'd probably be better
it's a
than I'd
little
be
better
better.
than just
Yeah.
checking out the piece of
Yeah.
paper.
One of the things that I wanted to mention was, we recently, over Nurses Week, did a small little campaign, awareness campaign, during Nurses Week, and we handed out nose plugs and a sheet of paper. But if you stop, we just kind of stop people as they would walk by our table and say, hey, do you wanna, we have some information about safe swimming, and they would just keep on walking. But if you said, we have some information about how to keep your child safe from the amoeba, they would like literally stop in their steps and turn around. So I think calling it safe swimming is not, or water safety, it does not have the same impact. People think it's boating, it's putting on a life jacket, it's, you know, getting lessons, drowning prevention, all that kind of stuff. They don't associate safe swimming with the Nigeria, that word. The amoeba. Amoeba. I'll just call it the amoeba.
One thing I wanted to just be clear on also, besides prevention, I think awareness has to do with people knowing if they're gonna participate in those activities, know what to do if X happens. You get a headache, you get a fever, go be evaluated right away and tell the doctor that you were participating in those activities. So, you know, just because we can't put signs or about prevention, or there's resistance about prevention, I think, you know, they would welcome the information. And I know that parents have told me, I want this information, my kids do this. Thank you for letting me know what to look for. Because, you know, if they don't, and then they delay treatment.
I think the 5-minute video that we saw over there, I think that should not be the last that should be seen. I think more people should see it. I don't know if YouTube or Facebook, especially if they condensed it a little bit shorter, people would share it. Easy and cheap.
At the Florida Department of Health, I mean, I definitely would love to be able to have access to that video so that we could disseminate it to some of the other states that were so strongly opposed to making it a nationally notifiable disease, and see if that wouldn't help maybe change some of their perceptions and, just make change happen.
So which states were opposed?
Several.
So can I ask, what is the motivation behind that?
So what?
In your perception.
From the call, and Dr. Cope, do you want to start, and then maybe I'll?
I mean, it's not against PAM exactly. It is, the list of nationally notifiable conditions is fairly lengthy. There's probably things that should be reviewed and maybe taken off, because they're not so relevant anymore. So I don't think people are, at CST are looking at this and saying, we don't care, we don't think this is important. Like, they view it from a very logical side where they're just like, the list of nationally notifiable is too long. I don't care what you're telling. I mean, I honestly think you could come with some other disease that has a lot more numbers behind it and
But
try to
that's-
add it, and they would say.
That's why I'm asking. I mean, this disease probably has a lot more numbers behind it, but you can only report what you have had the opportunity to verify, right? And then that's the whole start of awareness and the whole start of.
So the lack of national notifiability does not prevent people from reporting it
Right.
to us. And this day and age, I do think that, particularly with the media attention that's drawn anymore,
Yeah, it seems like the last couple years.
we hear about, if it's diagnosed, we hear about it. Where I think the barrier is, and this comes back to awareness, is diagnosis.
Right.
And so I do think there are unspecified meningitis cases that go, for whatever reason, are not further investigated and are probably PAM cases. I think, on my figure, those 0 years, there was probably a handful that just weren't further diagnosed. So that's where I think, that's why I this awareness, so someone needs to think about it to go ahead and then order the testing that would diagnose it. Whether that's before or after, even after death, it's still worthwhile because we learn more about, what the exposures are. Even if someone's died, we can still gain knowledge from that. So that's I don't know if you want to,
And from the conversation that we had, I mean, there is costs involved that the state have to incur when something becomes nationally notifiable. They have to change their reportable list, they have to print it out, they have to resend it out to all physicians and laboratories. And so to me, some of it came down to cost in adding on another disease that it was impacting and just then having also the reportable disease system being able to capture that and additional changes that would go in. And I understand that, but at the same time, in Florida, we've done it and we've been successful, and I think you just have to make it a priority in their state. And not that I'm hoping that there are more cases that occur in every state, but if that's what it has to take to get buy-in.
It'd be interesting to look up the last time something became, well, I know when that is, nationally notifiable, it's Zika. So,
Right.
But it has to be something that Ebola, it reached this national level that people just, yeah.
Can I say something? National level's good, but I think we have to start somewhere, right? Like, these are really good ideas. I just want to share something. I'm not sure if some of you belong to the acute stroke. You're in the acute stroke, right? Acute stroke committee, okay? And their slogan is "Time is brain," because really, we try to save the brain. And I know that starting a few months ago, they had a goal to reach at least 1 million people within Orlando to tell them the signs of stroke. So, and they wear their t-shirts, and then they have their stroke, and then like the time they came to visit, I had 45 people listen to them in little groups. But maybe we can even start that, to have a goal. Okay, let's hit X number of people, 50,000 or something, I don't know. But let's just go out there and talk about it. Because for me, if you give me a newsletter, you let me go to YouTube, there's no time. But when you do a one-to-one and people see you and people see a video, that's when it stays in the brain because you're hitting more senses. That's just my passion about Amoeba.
So I think this work group has a chance to convene into subgroups that, you know, work with the PTA or work on the professional and hospital and actually do something over the next year with the great ideas that are coming up today. Myrna, sitting over there, raises her hand, and she's process recording this so we can show some slides at the end and describe some of the wonderful ideas that you're coming up with, right? But this is obviously just the beginning of a conversation and actually doing some work over the next year that will hopefully bring about change. And we see, you know, how difficult it is to do something like national notifiability, but just having an idea like the stroke awareness coming into play for Amoeba, that could be huge. How do we do that? You know, or what Andrew has up there with the posters from the high school. Maybe one of them is just the tickets, you know?
We like the rhythm thing too.
I think we gotta hear that, I think we gotta hear the hip hop song, I really do.
So how do we raise awareness for physicians and laboratorians? The CDC, I mean, I know that you've talked about in the earlier, where the one individual that went to CDC to the course and then identified it. I mean, what can we do on that front?
We wanted to do a CME course, so if we develop, at CDC, we can offer CME for free. And I know we have a variety of mechanisms for doing that, but one I think that could work well for this, because I've seen an example before, is an online course that would just be there at any time for someone to take for free. And so that's something that's kind of been on our wish list. And I think, you know, we have to talk about ways how you get, you know, obviously a physician, if they don't know about it, they can't take it. So you have to think about how you get that message out. But there's a variety of, I'm sure, listservs and things. And I know free CME is kind of a, you know, if it's free, it's probably more likely to be taken. So, yeah.
Would it be two separate courses, one for physicians and one for laboratorians, or would we want one that was together and do laboratorians need CMEs?
We could I mean, it might have some similar content up front, and then we could focus it a little bit differently. Yeah, and we have a lot of pictures that we could incorporate. That would, you know, the laboratory side would probably want to have see more pictures to know what they're looking for.
Because, I mean, that does seem to be, it's the astute laboratorian, it's the astute physician that, you know, has led to this success. And so how do we make more of those?
Yeah, exactly. How do we get one of those in every hospital or one of these patients?
Well, what we
present?
have now in the system for the laboratory, as soon as we were aware, I mean, we've been working on this, but in master control, where we get all our SOPs, everybody had to take a mandatory quiz, and I threw out the full blast pictures of the laboratory, you know, pictures, etc. We are dealing with that, and you have to take it. Because, you know, some people will say, well, Orlando, you're so acute and all, and Kissimmee is smaller, but you know what? That person could walk into Celebration or a Apopka. So all the technologists, anyway, have that on hand right now.
Could you share that with, you know, CDC or us at the Department of Health, or is that something that could be shared out at, you know,
We can
on
certainly
a
talk
larger
about it.
scale?
So I have a quick question, and I walked in a little late, so I don't know if this was covered. So I live in Broward County. Is there any partnerships that Florida Hospital has with a hospital system in Broward County to increase the awareness, and that's kind of the goal here, and also with, you know, Sebastian's case, I mean, tracked up here, he lives in Broward County, is there any way to kind of tie that together and build some momentum?
That's what we'd like to do. I think we should. Like New Morris is a children's hospital. Winnie Palmer, right?
Right, yeah, because there's Chris Everett with Broward Hospital, there's
Right.
Miami Children's, you know, so maybe there's something that we could do there, and I'd definitely be part of that to help bring the organizations together if I can help out at all.
Well, it sounds like it'd be very worthwhile to pursue a children's hospital initiative statewide, right? And, you know, the Florida Department of Health is a statewide entity and is part of this conversation too. So from the perspective of the Florida Department of Health, we would very much favor, you know, a statewide consortium of the children's hospitals, if that can be arranged. You have all children's at St. Pete, which is here today. And if you can represent Broward, and you know, you have a lot of hospital systems in South Florida, I think that's wonderful. I think that's really ideal. But in this area, you know, Florida Hospital has 24 operating units throughout the state. I don't know where all of them are, but they're pretty big. So I'm sure they have connections to the South Florida hospitals too, in some way, shape, or form.
If I may, one of our goals for the work group is, before we leave, is we'll have these ideas, we'll have some objectives, and then we'll have the spark rooms, and you guys can be thinking, because that's where the real work will be done. You guys can get together with certain ones who want to go forward with the statewide Children's Hospital Consortium. Others can go forward with and meet via the virtual meeting rooms during the year. And then you can all report back to each other via the spark rooms and talk about what you've done and what your next steps would be. And we'll have a one or two folks that y'all can decide on here, one or two, that would help facilitate that. That will bring the people together at a certain time. Everybody is Friday, November 1st, good for everybody. We'll meet in the spark room, something like that. See, that's the idea. And that would be someone that kind of helps move that along and bring everybody together. People can report out who have decided they want to pursue certain things, that, you know, you can report back and on certain things. PTA, somebody can decide, well, I want to approach the statewide PTA. Okay, do that. Let us know how it turns out at our next SPARK meeting. Or I want to get the Children's Hospital Consortium going. Okay, you know, take that on. So everybody may have some different interests here along awareness and prevention. And so it'll be an ongoing thing.
So one of the things I was going to do right now, is we're limited on time with this session, is maybe focus us on having subgroup facilitators. So was there any particular subgroup that caught your attention, or do you want to be still the overall guy?
Actually, the PTA.
Cool. Yeah. So, you know, schools, camps, PTA, we can have that be the community awareness piece, but really work on PTA. That would be very cool, right? And then Scott, who works with Cisco Systems at the foundation, and I'm sorry, your name? Maria from Florida Hospital can pick up the piece that works on the hospital systems, professional awareness, and perhaps the network of children's hospitals and other hospital systems across the state of Florida, right? And then the third one that's down at the bottom is sort of our public health-ish, public space kind of thing. And you know, maybe that, I don't know, does anybody have an interest in this one of model statutes, water systems, neti pots, any of those issues? We don't have to, we just say that, you know, that's a potential third one if we want to.
May I ask about the camps and maybe doing it ahead and rather than reactive, proactive? I don't know if anyone's interested or what that would fall under.
Camps, break it out separately from like PTA with schools?
Or keep it in, but just to have it, and have someone
There's a
that might
question.
be interested in.
Does somebody want to just
approaching
focus on
it.
camps as a separate work group or objective? Does PTA think they want to take on camps also? How do we message this? Yeah? No?
I think it would be the same message.
Yeah.
It's the same message. I don't feel like
It's a two-different organization. Yeah, and then just find, you know, towards the summer or whatever, just start switching over the other way.
You know, maybe this third one is sort of the public health space, Jamie and Dr. Cole. I mean, this is kind of what we do, health protection. We can need to keep wrestling with that in the public space and saying, you know, how can we do a better job with that? You know, Center for Science in the Public Interest, national organizations that look at issues like that, Consumer Product Safety Commission for warning labels on neti pots, whatever, And we can at least ask questions of those organizations, write a letter to them and say, what are you guys doing? Are you doing anything, right? So that sort of takes up this session. Now, what's going to happen in 5 minutes, they're going to reconvene back in the main sanctuary over there, and that will be 5 minutes before the luncheon. But we have 5 more minutes for discussion, so more thoughts? Yeah.
I'm gonna do the email thing. So I'm
Yeah.
gonna pass around a clipboard, so that we can get everyone's contact information. Can you, on this clipboard, just put your email address and which initiative, whether it's the hospital systems or the community awareness that you wanna be involved in? And if there's anything else, or something else you wanna be involved in, take a note.
Also, we are going to vote on the posters. So if you have, we have more paper, I believe, unless you have enough, let me know. And they're all numbered. And if you need an extra sheet, you can just write a number down on the sheet.
What school is this from? Jones High School.
Does anybody need a sheet?
You want us to put a little piece of each?
Oh, it doesn't matter. A large one's so fine. Just put a number down, or just try to. How about first, second, third? Anybody need a number?
Just a couple of notes.
Okay, so what do you want
First, second, and third. Well, and the next question is a very obvious one. How are you going to know the results? Well, that could be through the Spark Room. So now, what I'd like to also circulate. Where does it put on the float out? What I'd like to do is get something around right now, because I'm not sure, frankly, if we have a way. Otherwise, did all of you choose awareness and prevention when you registered? Do you recall doing that?
Good for
Okay.
you. We're proud of you.
Well,
Knock the
if
ball
you,
out of the park.
I want to make sure that we have your email address so that we can, do the Spark Room. And I'm just going to put A and P up here at the top. And if you could please write your email down on this.
I think there's a clipboard going around already.
Sorry about that. Okay, so please be sure you do fill out the one that's circulating with the email address.
Can I just, add a comment? The petition for the nationally notifiable list, I have, out on the table where the wristbands are, there's, a little flyer. And if you have a QR reader on your cell phone, you can snap it and it takes it right to the page and you can sign the petition. So if anybody's interested, then you're more than welcome.
What I think is great about this contest that they had at Jones High School is it gets the kids to research and find out about it. And great for that contest would be to get their friends to vote on it on Facebook. So there'll be like memes that people will be sharing, and then they have to vote, and then they have to advertise, please vote for me.
Yeah, a domino. Awareness, yes, absolutely.
Who else is voting?
So it's food for thought, ongoing. And I will take your votes if you like, but Dr. Humphrey, the voting thing is on the Amoeba awareness website.
If you pick the right posters, we're going to let you hear the rap song. Go for it.
And it's, it starts with Townsend City.
Yeah. You think, what's the
Okay, listen up, folks. You are getting ready to hear the worldwide debut of this original song on the Glaria.
Now listen up.
I was going to start, right?
If you are done with your voting, just hold your hand up and I'll take it. Perfect, thank you.
So I know that
was the sound. Comes out of there.
Silly of me to jump into the lake. But when I got out, I was feeling great. 1 week later, I got a headache, sudden fever, and my neck was about to break. I went to the doctor, and the doctor said, oh my gosh, you're infected. Malaria is an amoeba. Sorry girl, I wouldn't wanna beat ya. Hey, I have no more life to give. I got 5 more days left to live. The doctor came back. He said there was no cure. I'm so sad. I'm gonna die for sure. Please be cautious when swimming in freshwater areas. The bacteria feeding amoeba nuclearia travels up through the nose to the brain and destroys brain tissue. Some symptoms are stiff neck, headache, vomiting, sudden fever, nausea, and seizures. Please be careful when jumping into lakes. J-High Production. Holla at me.
All right. You have heard the worldwide debut of J-High Productions. Thank you all.